I want to run through a few updates on the Commonwealth's COVID-19 plans. Over the weekend, I think many of you know, we launched new efforts to secure more personal protective equipment for our first responders and medical workers. We initiated a significant piece of our surge capacity plan to help hospitals free up more space. We launched another project in cooperation with the Mass Medical Society to recruit medical professionals to support our medical providers. And I'll also share some information regarding unemployment assistance the unemployment assistance process as it relates to the CARES Act, which I think everybody knows the President signed a couple of days ago. Over the weekend, the Commonwealth conducted close to 10,000 new tests for COVID-19 on our residents, which brings our total number of tests to almost 40,000, conducted at 21 labs statewide. And on both Saturday and Sunday, we continued to exceed our goal of 3,500 tests a day. We'll continue to expand testing capacity as time goes on, and as we said before, ramped up testing combined with tracing and tracking and isolation and quarantine is going to be a key to how we move forward in the long run on managing this virus. While these have been unprecedented and difficult times, the people of the Commonwealth continue to respond with tremendous strength and generosity. We're fortunate to be home to many resourceful people and successful businesses that have met this pandemic as an opportunity to do something positive and good for their communities. Our command center has been contacted by hundreds of individuals and businesses willing to donate or sell personal protective equipment or PPE to the Commonwealth. Over the weekend, we also received a shipment of PPE from the Strategic National Stockpile. Deliveries began on Saturday and have continued through Sunday, and the warehouse has been inventorying items throughout the weekend. We also heard over the weekend that the Assistant Secretary for Preparedness and Response at Health and Human Services at the federal level approved our request for at least 1,000 ventilators, and we should be receiving those soon. So far, we've made hundreds of deliveries to frontline healthcare providers and first responders, and last week, more than 28,000 masks and 120,000 pairs of gloves were distributed, and we currently have approximately $50 million on order for additional supplies. But obviously, we will need more. Yesterday, the Command Center launched an online portal where individuals and companies can donate or contract with the Commonwealth to supply PPE. The portal is simple and a very streamlined and easy way for our Command Center to process, collect, and distribute donations more effectively. By visiting the COVID-19 PPE procurement and donation website, businesses and organizations can sell or donate critically needed personal protective equipment, and this would include N95 masks, surgical masks, respirators, goggles, gloves, protective gowns, and hand sanitizer. And the new program isn't just about donating or selling. We've also heard from many people and businesses who may not have gear to send us, but do have facilities that properly converted can be used to generate gear all the time. And our administration's created a process where local manufacturers can get more information on how their businesses can start to produce the equipment we will all need. This function is a result of our Manufacturing Emergency Response Team, which is co-chaired by Housing and Economic Development Secretary Mike Keneally and Mike Tomasi, who's the President and CEO of AccuRones. We've already seen Massachusetts companies do this, and it's both impressive and inspiring. For example, New Balance will begin manufacturing face masks for those battling coronavirus. They're producing prototypes in their Lawrence manufacturing facility and hope to scale production using their other New England factories soon. By harnessing the capabilities of Massachusetts skilled manufacturers, we'll be able to get gear into the hands of our frontline workers faster. We still have much work to do to secure more supplies from both the national stockpile and from other supply chains, but we've always been impressed with the ingenuity of our residents and businesses, and this outbreak, undoubtedly stressful for all, has shown once again that people can step up in creative and imaginative ways. And companies like New Balance and so many others that are taking this in stride and coming up with solutions is exactly what we would expect to see happen here in the Commonwealth. It's the truest example of the spirit that makes Massachusetts so special and what we're so proud of. And I want to thank everyone who's reached out so far to support our first responders, emergency management personnel, and healthcare workers as we continue this fight. Protecting the people who work every day to keep us safe and healthy is obviously of huge and significant import to all of us. And that's why we're pursuing every possible angle we can find to get them the gear that they need. This weekend, we also launched another initiative to recruit medical professionals to support our hospitals as we ramp up our medical capacity. We partnered with the Mass Medical Society to match health and medical volunteers with our communities and healthcare providers based on skill sets and requirements. There's an immediate need for respiratory therapists and public health nurses. And since launching this initiative, more than 1,800 people have already registered, and we're incredibly fortunate to have so many highly skilled technical professionals in our medical community here in Massachusetts. Other medical professionals who might want to help can sign up by visiting mass.gov/COVID-19. To all the doctors, nurses, and folks who keep our hospital running, your compassion, your bravery, and your commitment to your fellow Commonwealth residents is unbelievable and outstanding, and we are all enormously grateful. I do want to talk a little bit about a couple of other initiatives around planning for the surge. One of the core functions of the COVID-19 Response Command Center is to expand our existing capacity to serve people once the surge arrives, and they are working on a variety of initiatives to ramp this up. First of all, reducing pressure on the system overall, in part by issuing more than 30 orders or guidance aimed at keeping folks who don't absolutely have to be in the hospital out of the hospital, making it possible for clinicians to engage with one another in more flexible and management-specific ways, and also in developing additional capacity so that the Commonwealth has the ability to work with our colleagues in the healthcare community to ensure that we have the right kinds of beds in the right places to serve people once the surge arrives. This week, the COVID-19 Response Command Center is establishing a dedicated skilled nursing facility, a set of dedicated skilled nursing facilities to care for older adults who are infected with COVID-19. This is one more way to relieve pressure on hospitals and maintain acute care capacity for patients who are critically ill. This will allow hospitals to move more patients into the recovery phase and out of hospital beds and into a safe, professionally staffed setting. We've already started this effort with the Beaumont Rehabilitation and Skilled Nursing Center in Worcester. We all understand that this is a disruptive activity for current residents and their families, and in many cases also for staff. And our teams are making every effort they can to make temporary relocations as smooth and as comfortable as possible. And we're especially appreciative to the leadership and the team at Beaumont who have answered the call from the Commonwealth to be the first of these needed designated skilled nursing facilities. Beaumont will help us bring 300 skilled nursing facility beds online in the Worcester area, and they anticipate opening 150 of those beds by Thursday. We need to continue to create significant capacity so our most vulnerable population, should they get infected with COVID-19 and need acute care in a well-equipped and safe setting, will get it. We know this isn't an easy task, but without these designated sites, hospitals would have to discharge COVID-19 patients to any skilled facility with an open capacity, which could put the rest of the healthy residents and the staff at those facilities at risk. This step will help us avoid imposing a mandate on skilled nursing facilities to take COVID-19 patients from hospitals, and will have those facilities that are actually stood up to do this work much better positioned to do it well, to do it right, and to do it safely. The goal is to have about 1,000 beds available for older residents as we plan for the COVID-19 surge. We've also received federal approval from CMS to implement this program, and we'll continue to work this issue around the clock to increase our bed capacity to prepare for the surge. Finally, I'd like to take a minute and update the situation with respect to unemployment benefits. I think most people know that last week Congress passed a substantial federal relief package that includes significant resources for unemployment insurance. There's a lot of good news here. And perhaps among the most important good news is the federal legislation will provide unemployment compensation to individuals who do not currently participate in the unemployment insurance system and therefore are not covered under existing federal unemployment law. This includes individuals who are self-employed, those who do contract work, and those who get paid using what is called a 1099. Those individuals, in addition to that, individuals who have recently exhausted their weeks of unemployment benefits and individuals who do not have sufficient earnings over the last year to qualify for state unemployment would also be eligible for this program. The CARES Act also extends the number of available weeks of benefits for all claimants and supports claimants' weekly benefit amount by $600 for the next 4 months. The not-so-good news is that states are still waiting on guidance from the federal government on how to implement and start distributing these funds. We expect this guidance to detail application requirements, business rules, eligibility determinations, exceptions, and technical requirements, all of which are critical to assuring that this program gets off to a good start. We continue to have active conversations with our federal partners. In fact, people were on the phone all weekend with them. But these benefits are not available to be applied for today. Right now, it's important that Massachusetts residents seeking these new federal benefits don't apply through the state's current unemployment insurance platform. Until the program is actually implemented under the federal guidance, those resources won't be available and the rules won't be in place to determine eligibility or how much people get on each of their checks. If you attempt to apply for them now, you won't be able to get through the system because the system won't actually have your name in it, and it may create a risk and a traffic jam for others who do qualify, who do participate in the existing unemployment insurance system and are able to access existing unemployment benefits. Everybody could really help us on this one, and the hundreds of people who are currently working to process claims, answer phone calls, and deal with questions and concerns, if people who are eligible under the new rules can wait to apply for the new federal resources once we actually get the information from the feds about how to implement the program, and we can then make that information available to all of you. The Executive Office of Labor and Workforce Development will post an update as soon as we get guidance from Washington on this with respect to the rules of the road. Please know our administration is committed to ensuring that these resources get to the people who need them, and we understand the urgency for everyone during these particularly difficult times. Updates will be posted on mass.gov/unemployment/COVID-19 as soon as they are available. I think some of you know that last Saturday, my wife Lauren and I visited the Red Cross in Dedham to raise awareness of the need for folks to continue to donate blood during this time. There is a crucial need for blood donations, and this need is not going to go down anytime soon. When we issued our emergency order ordering the close of all non-essential businesses, we specified blood and plasma donations as an essential service for all the reasons that would make sense to just about everybody. And even though so many of the things we typically do on a day-to-day basis have ground to a halt, things like giving blood are not only important, but more necessary than ever to ensure the health of our residents and our communities. It was great to see people out on a Saturday serving their community, even in the midst of these very uncertain times. The Commonwealth is chock full of residents who are dedicated to making this a great place to live, and my wife Lauren and I were both reminded of that in a powerful way on Saturday. I want to say thank you to all the residents of Massachusetts for their patience and their perseverance and their determination during this time. We know many of the measures that we've put in place have been disruptive and difficult, but if everybody follows them, we believe they will have a significant impact on slowing the spread of the virus and make it possible for our healthcare system and our communities generally to manage the surge and to come out the other side of it in a position to successfully figure out how we move forward from there.